Good afternoon, everyone, and thank you for joining me today for our webinar on preventive care billing in the FHO. Today's webinar will be recorded, so if some of you have to leave early or some of your colleagues weren't able to attend, we will have a recorded version within a couple of days, so we can definitely send that off to you. As well, I just wanted to point out that we're going to go through the webinar and the preventive care topic at a pretty high level, just because there are so many different people with so many different levels of understanding within the preventive care billing world. So, you know, if you do have a little bit more of an in-depth knowledge of the topic, that's great. But if you are a little bit, you know, lesser knowledge, so then that's perfect for you. If you do have any specific questions, my contact details will be provided at the end of the webinar, and I would be more than happy to speak by phone, or if you want to send me an email, and we can set something up accordingly. So with that, let's go ahead and get started today. So a little bit of the purpose of today's program, just give you a little bit more support towards the area of billing in preventive care, and a walk through about what the program is and what to do on a high level. What exactly are we billing for? What are we tracking? And what needs to be done? So the preventive care bonus is about 2% of the bonus category. Now, some quick facts about that. $12,800 available across all 5 screening levels. The average physician will earn about $8,500. Again, depending on the practice size, the practice demographics, the area. I mean, so many different perspectives and so many different items come into play when being able to bill and obtain the different service levels. Again, demographics are a big part of what the bonus is all about. If you don't have the demographics in certain categories, it really is tough to get. If you have too many in one category, again, it's really difficult to get. So it really is based on the demographic, based for the targets that you have to hit. For example, mammograms, 75% of women at risk between the ages of 50 and 74 are screened, then you'll get your bonus. However, if you have a tremendous amount of women between the ages of 50 and 74, and some of them just don't want to go, or for whatever reason they aren't able to go, again, it makes it that much more difficult to obtain. So the different categories that are available, of course, are the pap smear, the mammogram, the colorectal screening, the flu shots, and the childhood immunizations. Now, we will go through each one of these categories unto itself and provide a little bit more detail. Again, as I said, if you do have a specific question about, you know, flu shots, for example, or the colorectal screening, by all means, please write them down, and I'd be more than happy to speak with you at the end of the presentation or via email, and we can clarify the answer for you. So what's the difference between billing codes and tracking codes? So for example, pap smears, there's 6 different billing codes that are available there depending on the location of the services being provided. But there's also a tracking code and an exclusion code. So what does that mean? When you have these billing codes, they're not necessarily being tracked for the preventive care bonus program. So the tracking code, the Q011, is there for you to submit as a tracking code, not a billing code, in order for the ministry to understand that you have provided this service to that patient. Now, why is this important? Because when you receive your report in either October or April, as you get 2 per year, it's important for you, so you don't have to go back and look at all your patients that are being tracked or provided the service to see if they've actually had the service. This allows you and the ministry to indicate who has had the service and who hasn't. Makes your life that much easier when trying to calculate your bonus percentage. And again, something that we're going to get to in a little bit. But basically, the reports are showing of the pap smear category, how many patients do you have in that category, and how many patients have received the service, and how many patients haven't. Now, they're not going to give you a number, 20 have and 30 haven't, but they're going to show you what patient has and what patient hasn't received the service, so you can calculate your bonus accordingly. Now, there are tracking codes for all the services, as you can see, for the pap smear, the mammogram, the colorectal screening, the flu shots, and the childhood immunizations. Now, it's important to bill these tracking codes or submit these tracking codes on a regular basis once the service has been provided or the results have been received for this service. Now, flu shots is a tricky one. It used to be one of the easiest ones to obtain. Now it's a little bit more difficult because, again, you can go to the pharmacy, you can go to Shoppers Drug Mart, anyone that you can go to the supermarket in some cases to get a flu shot. Now, obviously, when that happens, it's not being tracked according to your demographics and your roster. So it's important to ask your patients, have you had the flu shot? Put up a poster in the office to say, it's flu shot season. If you've gone elsewhere for the flu shot, please let us know. They don't need to know that it's for the bonus category, but they need to know that it's for the continuity of care, making sure that you're getting, the best care possible, that just in case anything, God forbid happens, that they know that you have or haven't had the flu shot or whatever the case is. So it's important to know and to let the patients know that this is something that they should be letting you guys know about. Now, with regards to exclusion codes, and we do get quite a few questions, when do I bill the exclusion code and what does it mean? Basically, the exclusion code is there for people who are not eligible for the service. So if they've had cancer or if they've had a mastectomy or whatever the case is, and again, we will get into a little bit more detail as we go through each category, but that's where the exclusion code is coming in for people that aren't eligible. As well, if they've had it in the previous year, obviously in the subsequent years, different subsequent years for each category, they aren't eligible for the code because they've already had it. So again, you can build that exclusion code, remove them from your population to make your life, again, easier in order to calculate the bonus. Now, there are, again, percentage attainments that are needed for each category, anywhere from 60% all the way up to 80%. Now, each preventive care category has a different amount that you're eligible for or that you need to obtain in order to get that bonus level. So the target population, as we can see here, is the high-risk population within the age categories for different programs. The service interval, again, is different for each category. For example, mammogram is every 2 years. As I said, the exclusion codes, what are the characteristics to exclude a patient? Females that have had mastectomies are not required to have a mammogram. Those ideas. And some of the challenges, again, some of the levels are very high to obtain the full bonus level. So again, if you have too many people in one category or another, it's a little bit more difficult. Or if, for example, childhood immunizations, there's a big controversy around that now. Some people want it, some people don't. Again, if they don't want it, it makes it a little bit more difficult to obtain the bonus levels. So the influenza vaccine. So everyone 65 years and older is eligible. As you saw earlier, the tracking code is the Q130, and that should be billed every time you know that the patient has had the service, whether they're having it in your office or elsewhere. If you know the patient has had the service, you can submit the tracking code, the Q130A. Obviously, it's one shot annually and performed before January 31st of the given fiscal year, and the ministry fiscal is April 1 to March 31. There are no exclusions. Some of the challenges, as I've said, they can get it anywhere. People can, go to any street corner basically and find a pharmacy or somewhere to get the flu shot. So it really is important to know what your patients are doing outside the office and let them know that it's important for them to tell you what they've done outside the office. The minimum attainment is 60% to get about $220, and the max attainment is 80%, and you get $2,200. Childhood immunizations, again, the highest percentage attainment needed at 95% in order to get the max bonus. It's for babies up to about 3 years of age, and again, the 6-month stale dating rule comes into play there. The tracking code Q132A, again, anytime you have given the shots to the babies, you can bill that tracking code. As long as patients have received the service by their 30th month of age, give or take again with the stale dating, then it's important to know that you will get the bonus. There are no exclusions. And some of the challenges are, again, patients or families that don't want the service being done for their children. So for example, if you have 4 patients in that age group and one out of the families don't want that service being done, you're at 3 out of 4, only 75%, you're not going to get any of the bonus. So best practice is probably to de-roster that patient ahead of time, knowing that they don't want the service. And then once they've reached that age category, then you can re-roster them in order to maintain and get that bonus level. So for the pap smear, females between 21 and 69, the tracking code is the Q011, as I said earlier, and it's one pap test every 3 years. Now, there is an exclusion code, the Q140A, again, if they've had a hysterectomy or if they've had cervical cancer or any type of disease that doesn't allow them to have regular pap screenings. Those are the reasons why you would bill the exclusion code. Or if they've had it within the last 3 years or within 2 years and they're not eligible anymore until another 2 or 3 years, then you can bill that to remove them from the category. And some of the challenge here are cultural barriers, depending on the physician as well, male, female. Obviously, some females are not comfortable having the service done with a male physician. Obviously, you want to refer them out to a gynecologist or another female physician within your group that is able to provide that service, but still billing the tracking code in order to make sure that you do get that bonus level attainment. Again, 80% is for the max bonus here at $2,200, so it is obviously a fair amount, but again, there are ways around making sure that these patients do get the service if you are a male physician, as I said, referring them to the gynecologist or to another female physician within your group. Now, the mammogram, females between the ages of 50 and 74, again, the tracking code is the Q131. One mammogram every 2 years as they've changed it. The Q141 is the exclusion code. As I said, if they've had a mastectomy or if they're being treated for breast cancer or anything like that, not eligible to receive it. So we want to make sure that we remove them from the baseline of our category in order to get a closer to the limit of the 75%. So there are some challenges. Obviously, if some patients are being treated outside of your clinic or they're going to the Ontario Breast Screening Program, they may have the service done. They may not tell you. You may not get the results. So it's obviously important to follow up and get those results. And every time you do know for a fact that they have had the service done or that you've seen the results, then you can build a tracking code for them. Colorectal screening, males and females between the ages of 50 and 74, Q133 is the tracking code. One fecal occult blood every 2 years. There is an exclusion code of the Q142. Again, if they've had colon cancer or any type of cancer in that region, are being inflammatory, if they have an inflammatory bowel disease, anything that would make them not eligible. Again, if they've had a colonoscopy within the last 10 years, again, you want to build that exclusion code so they're not part of the category, the category, so you don't have to worry about tracking them or not tracking them. Some of the challenges, the stigma of undergoing colorectal screening, again, it depends on your patient demographics, where you are working in the city, what type of ethnicities you have within your practice. Some families and some patients are going to be, very open for it and really want to take care of themselves and see what's going on and do those kinds of tests. And then others are really not comfortable for religious reasons or what have you. So it does get challenging at times, but it is obviously important and good to stress that to your patients. Now, of course, the top bonus level is only 70%, so it's a little bit lower than the others, but still one of the harder ones to obtain. People are given the test, but they don't necessarily do it. So again, once you know that the test has been done, you want to submit the tracking code right away. And it does have the biggest bonus potential at $4,000, so something to keep in mind moving forward. So some of the logistics about providing and calculating your screening levels. So in order to receive the bonus, you need to calculate your screening levels individually for, obviously, if in case you're a billing attendant here, obviously you want to do it individually for each physician. And if the physician is doing it themselves, obviously you have to do it yourself too for each category. So as I said earlier, you get a report issued twice per year in April and October. The April report is the previous and final report. to let you know that these are the patients that have had the service within each category. And the October one is an outlook or a projected report to say, these are the patients in each category. These are the ones that have had it so far, and now you know who needs to have it before the end of the fiscal year. This is a little snippet of what the report looks like. Hopefully one day the ministry does make it electronic through your MCEDT accounts, but currently it is paper, and that is what it looks like. Again, I know it's hard to see, but they're going to show you the service date or the excluded date. So whether they're excluded from the category, or they've received the service, or they haven't received the service. So calculating your screening levels. So you're going to take the number of patients that you've screened divided by the number of patients in the target population minus those excluded. So if you have, as you'll see on the next page as an example, you'll see you have 750 patients that have been screened out of a total 1,000 patients within that age category. So we got to 1,000 because there are 1,100 patients within that category, but 100 of those are excluded for various reasons. So obviously 750 divided by 1,000 times 100 gives you 75%. And that really is the plain and simple way to do it. The most tedious work is actually coming up with who those 750 patients are in this situation, making sure that you know that which are the patients that have had the service within each of those categories, and then of course which have been or should be excluded from that as well. So submitting the appropriate billing code for the level of screening within that category. So obviously, depending on the level, the percentage that you've obtained, so for example, flu shots right at the top there, if you've only achieved 60%, you submit the Q100. If you've reached the 80% max, you submit the Q104, and so on and so forth down the line, depending on the percentage category that you have obtained. Now, it is very important to note, although you do have the 6 months in order to submit it, you do want to put a billing date of March 31st. Now, we've had a number of situations where, for whatever reason, when the physician or the billing staff have put in the submission for for preventive care billing codes, they have put the date that they're submitting it. So, for example, if they do it at the beginning of May, they put May 2nd, and it gets rejected. And for some reason, they may not pay attention to it. They may not realize that it was rejected. They just assume that it's going to be paid out in the next month or two. And all of a sudden, we get to the end of September. It hasn't been paid out yet. And and then all of a sudden in October, we're out above the 6-month stale dating rule. There's nothing we can do. So please keep in mind using March 31st as the billing date, again, for the fiscal year. So for this year, you're going to put March 31, 2014 as your billing date. And it is very important to make sure that that does get done, obviously sooner rather than later, because if they do have an issue of any kind, that you guys are able to go back and fix that issue. And for clients of ours, we'd be more than happy to assist if there are any issues in this area as well. So this is a little bit of what it's going to show on your RA. So it's going to show each category within the preventive care bonus, what percentage you've obtained, and in the current month it'll say that it was paid out, and then it'll obviously say year to date for your full attainment. So it really is important to keep an eye on that section of your RA, and again, for clients, that's something that we do on a regular basis. For the next several months, we will keep a close eye on that section in particular to make sure that everyone does submit their bonus and actually does get paid out for their bonuses. So some of the shortfalls and the issues behind the preventive care program as a whole, really we would like the ministry to calculate this automatically. I mean, it really shouldn't be on the doctors or the billing staff to come through and figure out. I mean, if you're submitting the tracking codes and the billing codes and everything that needs to be done, it should be done automatically. And sometimes things aren't captured, and that's, I think, where the biggest shortfall is. That, if they did calculate automatically, but you guys forgot to put a tracking code in or whatever the case is, then you wouldn't necessarily get the bonus level that you're eligible for. Services slip through the cracks. They're not billed properly. For whatever reason, they get rejected. And that's really what it is. Again, some track automatically, some do not. So the tracking code is really a good way to not rely on the ministry and not rely on the fact that some of the billing codes will track automatically, but to submit the tracking code regardless to make sure that you do get that category or that bonus level for each of them. So some of the key takeaways for today, of course, as I keep saying, submit your tracking codes regularly. After you've done the service or after you've seen the report, submit that tracking code. Bonuses, again, can be submitted up to September of this year, and of course using the billing date of March 31. Targets obtained can be billed through your EMR using a mock patient or via paper, whichever you prefer. And higher levels can be resubmitted, and the ministry will pay the difference. So we do see in some situations where they'll go through and submit the bonus codes in April, and then all of a sudden they realize they missed some patients, or the patients have had the service, or for whatever reason they weren't tracked properly, and then all of a sudden they realize they could have gotten a higher amount. Don't just ignore it and think that the ministry is not going to do anything about it. Resubmit, and the ministry will pay the difference that's owing to you guys. So that brings us to the end of the presentation for today. As I said, we're going through this at a very high level. Each one of you may have different, a knowledge base or needs or questions about that. So we don't want to, confuse people or give too much or too little information to some people. So as you can see here, my contact information is there, and I'd be more than happy to answer specific questions for you. Obviously, some of our clients, we do help on a regular basis with this program, helping with the submission of different bonus codes and what have you. So obviously that's available. And for those that aren't our clients, we'd be more than happy for you to reach out to us as well and see what we can help you with and potentially work with you on a regular basis moving forward. So again, thank you very much for joining me today. And we will have a copy of the webinar recording available within a few days for those who haven't had the chance to log on, or if you had to leave early for whatever reason, or if one of your colleagues would like to see it. I will be following up with each of you to see what's going on and make sure that everyone is okay. And again, thank you very much and have a wonderful day.